Hi, besties. Welcome to the CB Friends Daily Show with
Ariana.
Eva,
Eva.
Ariana.
Oh no, Ari, are you sick?
I think a little bit.
Well, while you care to have some water from our brandly new CB Friends Daily Show mug, I'll tell you who is also sick.
Who?
Our planet is sick.
Fully agree.
We are living a planetary crisis that's obviously affecting the health of our planet, but ultimately our own health and well-being.
Definitely. And this is what we were talking about with some CB friends this time. Let's start with the basics, as always, for you guys to understand a little bit the link between climate change and health. We asked Remco from UNU IIGH, based in Kuala Lumpur, what is this link? Like, what is the main link between climate and health?
Roll the clip.
So hi everyone, we're here with my colleague Remco. He works at UNU IIGH based in Kuala Lumpur, and it's one of our sister institutes from UNU EHS. So I'm very happy to have you with us, Remco, at the Capacity Building Friends Daily Show. And this time we're talking about health. And the question for you is to give our audience a little bit the basis, the 101 on health. So the question is, what is the relationship between climate change and health? And what are some of the most urgent health impacts linked to climate change?
Thank you, Ariana. Well, that's an important but also broad question because climate change has a broad range of impacts on health. First, to begin with, pure from a bodily perspective, and I'm a medical doctor by training. I mean, the body only can function in a limited range of temperatures. Our bodily homeostasis, the balance, is quite tightly regulated. Our body stays within 36 till 39, 40 degrees max, and if we go below it and above it, then it means death, unfortunately. So it's more fragile than we believe. If, for instance, extreme heat and other weather events make that we can't release the heat from our bodies anymore. So I think realizing that the outside temperature that has direct impact on our bodies. I think that's really at the core where the climate crisis and health is connected, because we can't thermoregulate anymore. That's why there is such a demand for air conditioning in this part of the world during heat waves. That's why we need to have ice packs and other ways to cool down. That's why we need to dehydrate, and we need to be in the shade when the heat is too extreme. So these considerations are at the core. It of course works also the other way around. There might be more extreme winters in part of the globe, and we need to find ways to stay isolated and warm. But overall, the extreme heat affects urban heat islands. I think they are the most prominent. You need to have heat adaptation plans, etc. People would need to adjust their daily rhythms and how they function in their work, and do part of those activities very early morning or late in the eve to escape most of the heat. So this is all very real. So I think this is at the core what the relation is. If you look one step further, then it's the impact of the climate crisis on societies, on biodiversity, on vector-borne diseases and their habitats. So there might be more mosquitoes and ticks and the range where they're active, that might change. Also in relation to precipitation patterns. So we see more emerging infectious diseases. Just to give an example now, there's a hantaviral outbreak on the cruise ship. And we, from a public health specialist perspective, are like, so why did that happen? And it might be that through climate crisis, also disease transmission and the habitability of those viruses become more favorable. It's one example. Another one is water quality is being directly impacted also through the climate crisis. Another sister institute, UNU sister institutes, working on really water governance. And the message there, it's not so much the amount of water, but the quality of water, and the quality of water reduces, and then it can harbor more pathogens as well. That leads to waterborne diseases like salmonella, and especially cholera is in part of the global south a problem. So we see those emerge over time. And then there is things like food insecurity and malnutrition. And one also needs to be well nourished to be able to develop an immune system that wanes off infectious diseases. So also with our immune system being impacted, with a lot of children maybe having stunting, and so they're relatively malnourished. It's not that they have enough calories, but they lack quality nutrition. It might actually lead to them not being able to wane off infections like measles infections you see in part of the world. So that's one side. On the other side, there's also because of the climate crisis, we're less mobile, more sedentary. We have a lifestyle also that makes that chronic disease and overweight, etc., diabetes, cardiovascular risk problems become more prominent. And then if your body is in such a state, if you then have to pass part of the day through in extreme heat or then you're less adaptive as well, then you're more at risk. So I want to say they're interacting with each other. It's like negative tipping points, but within the body itself as well. And I think that for many people, they don't realize how relative at risk they are, even if they look from the outside relative healthy. But we know that the number of also at the global level, mortality escalates quite rapidly. And you have quite sudden, quite a lot of excess mortality because of, let's say, 7 days of extreme heat. And suddenly you see that there is excess mortality of about 15,000 people at the national level in that week. Those would be people that eventually would have passed away maybe 1, 2, 3 years later, but it's the extreme heat that knocks them off earlier, and they get a stroke, or they get asthma or get obstructed. So this is really from the disease risk perspective, but this is also part where the solution comes in, of course, which is had to do with a lot of greening, ventilation, people being prevent themselves being in cool places, that they know how to remain well rehydrated and nourished. So that's a little bit the field where we are engaged in.
And we're back. Thank you very much, Remco, for these great insights. All the impacts that climate change has in our health, like from mosquito-borne diseases, water pollution, from floods, everything that actually affects us directly.
Exactly. I think Renko showed us that the climate crisis is a health crisis. And he spoke a lot about the impacts on our physical health, but then it's obviously as well like mental health crisis. So for that one, we actually spoke to our CB friend, Eugenia, to tell us about the impacts of climate change on our own psychological and social well-being. So
we're here with my colleague Eugenia from UNU EHS, and we're going to talk about well-being and mental health. So how climate change impacts well-being and mental health.
Thank you so much for the question. Climate change can actually influence well-being and mental health in multiple ways. One way is that it can generate climate anxiety, stress, and feelings of helplessness, which in the end may reduce an individual's sense of agency and their capacity to act. In some other cases, it can, on the opposite, motivate people to behave pro-environmentally and take positive climate actions. The response is very depending on psychological, social, and contextual factors. For example, the narratives an individual is living in play a really important role here. If people are constantly bombarded by negative or catastrophic messages regarding climate change, it may negatively affect their mental health and make them feel powerless. On the other hand, when people see positive examples from their peer groups or communities, when the supporting infrastructure is in place, and when they have self-efficacy, a feeling that their actions can make a difference, it both can encourage well-being and sustainable lifestyles.
And we're back. Thank you so much, Eugenia, for such great insights. Like this link between climate change and the psychological well-being, and how climate anxiety can also help us to act for climate.
exactly, climate anxiety can be a force in our advocacy and climate action efforts. But obviously, there's a lot of gaps that exist in health systems, in our communities, in infrastructure, in the policy level to really integrate health considerations and health policy into climate action efforts. And for that, we actually spoke to our CB friend Elena from the WHO to unpack this for us. So Elena, where do you see the biggest gaps in building capacity within health systems to respond to climate change at the community, institutional, or policy level?
Thank you very much for this question, Eva. I think that after working on capacity building for climate change and health for over 17 years now, I really think that the gaps are everywhere. We see that there is a lot of progress at policy level, at least in terms of awareness raising, also with policymakers more active in, for example, assessing climate change and health vulnerability at country level, and developing either health components of national adaptation plans or integrating health with international adaptation plans as a specific chapter. So I think that basically we did an assessment from 2020 to 2025, and the progress in those policies has been enormous. Then the real challenge is moving to implementation, which means that probably there is a lack of capacity to access finance by ministries of health, but also maybe a capacity gap at the implementation level, because not at national level, but maybe at programmatic level or subnational level, we don't find this action or the capacity to understand how the impacts of climate change need to be addressed by health systems and, of course, by community. There are many initiatives by NGOs and initiatives also by WHO that support the community to, for example, understand what a health early warning system means. Imagine a heat wave. So what the community needs to do to be able to be safe. And now it's evident with the heat wave that we are living also in Europe. I mean, you cannot exercise outside, you need to drink, you need to use the fan. But we need to do much more to ensure that communities and subnational levels and overall ministries of health have the capacity in terms of technical and financial to be able to respond to the health impacts from climate change.
And we're back. Well, Elena did not only show us the capacity gaps that exist, but also the progress that's been done to more systematically integrate health considerations into policy. And I think it also helps us understand that we have to look at the climate crisis and this health crisis from an intersectional lens, right? And one of these dimensions and one of the social determinants of health is obviously mobility and migration.
Exactly. And for that, we talked to our CB friend Rob Oakes from UNUEHS, who talked about the nexus between climate change, health, and migration, or climate mobility in the context of climate change.
So, Rob, climate change, migration, and health are often discussed as separate issues. Could you help us understand the interlinkages between climate change, human mobility, and health?
Yeah, thanks. So it's true that you find that these three, climate change, migration, health, are sometimes studied on their own, sometimes studied in pairs, but rarely studied as the nexus. That's what we call it when you have the three together. And that's something that we're trying to change. So we brought out a book recently that looks at climate change, migration, and health. It has a range of chapters discussing this. And it's also quite good news that the World Health Organization are bringing out a report precisely on this nexus. Let me just explain what this actually means, though. So the interactions between the three can sometimes be quite direct, but can sometimes be quite indirect. I'll just give you a couple of examples. So if we think about a drought perhaps hitting Africa, you might get pastoral farmers or herders who need to access water to feed their animals. They might therefore have a lack of food, and this can directly translate into health impacts, so stunting for children or malnutrition. And I think it's a bit more powerful to understand this as a health impact as opposed to livelihoods, which of course are important, but somehow a bit more difficult to understand. So in this context, they may be forced to actually move and find access to food and improved health. Another example would be in the case of if there's a cyclone in Bangladesh. So if a storm hits, people are displaced, people have to move perhaps with little or no time to prepare, and they might move into a displacement camp or into a city. And at the time, or perhaps after, it's possible that those who have been displaced would suffer from a psychological trauma. So it's also important to think about mental health as well as physical health. So when we say health, we like to think of it in holistic terms. So physical health, mental health, also access to healthcare. Because if you're moving, you might not be able to take your medicine with you. You might not be able to speak to a doctor, actually get the care that you actually need. So I think it's really important to have this framing. Until now, people haven't really been looking at this nexus, but at the moment there's a bit of a momentum to actually understand this, and I think it's a really positive way of trying to understand what is happening, and in this way we can really kind of address what this means for loss and damage, and we can think about how climate justice and human rights can also be improved.
And we are back. And thank you so much, Rob, for this. I think it was super insightful to understand and better understand the nexus between climate change, health, and human mobility in the context of climate change. And well, it's obvious that climate change impacts everyone, but it impacts more the most vulnerable.
Absolutely. And those health impacts are also distributed more unequally to the most vulnerable. So this all becomes a question about equity, right? Making sure that health systems have accessible, effective support and actually reach all of these most vulnerable communities. And for that, we spoke with our CB friend, Daphne, a climate justice advocate, to tell us more about it.
So, Daphne, how can we ensure that capacity building efforts to strengthen health systems in the context of climate change are truly inclusive and effectively reach the most vulnerable populations?
We know that the climate crisis is a massive public health issue and that the health of our planet and the health of our people are inextricably linked. So, as the climate crisis proliferates, so does the worsening health outcomes of people who are most impacted by climate infrastructure disasters, extreme weather events, and just any issue related to the deterioration of our planet. So when we talk about communities who are at the front lines, we think first and foremost of those who are experiencing floods and wildfires and other natural disasters. They're going to be displaced from their homes, which means that if they have any adverse health outcomes like uh, disabilities or other chronic illnesses, they may not be able to access their medication that they need. They may not have access to clean and healthy fresh water. They may not be able to access regular doctor appointments because they've been displaced from their homes. But then when we talk about sort of the more systematic effects, we think about changing weather patterns and people who are now facing extreme heat or extreme cold, and they live in places where the infrastructure is not built to handle those changing weather patterns. And that also brings economic strain. So if you're having to uh, use a space heater or a cooling system to keep you cool or keep you warm, depending on the weather, those are extra economic costs that you are having to account for now because the environment around you is changing. So I think that when we're building infrastructure that is accounting for health and equity in relation to the climate crisis, we really have to make sure that we're including infrastructure bolstering efforts so that we're putting economic input into communities so that they can become climate resilient. It's not just about preparing for the disaster after it's happened, but it's making sure that the communities are resilient enough to withstand any issues that might come in relation to the climate crisis. It's also making sure that folks understand the real health impact of what the climate crisis can bring to them. Oftentimes, that health connection is miscommunicated in the education portion of talking about the climate crisis. So helping people understand that if you have pre-existing conditions like diabetes and hypertension and things like that, the climate crisis can worsen those things. And I think that oftentimes communities who are on the front lines, they're already facing so many other inequities like living in food deserts, having very little access to equitable education, having very little access to affordable and clean medical care, that they are often not thinking about the systematic um, impacts of the climate crisis because they're just trying to get their daily needs met. So it's really making sure that we are sort of linking those nexuses together so that folks are really understanding the overall impact, but then also really making sure that folks who are already disabled and have chronic illnesses are included in those conversations. I myself, as a disabled climate organizer, don't really see myself in this space very often, and I'm constantly championing the voices of disabled people as climate solutionists. I talk about how disabled individuals are adaptive and resilient, and those are traits that we need to really come up with solutions that are inclusive and equitable for all folks facing the climate crisis. And I mean, that's truly everyone who lives on this planet. This is all our fight to carry together, and we need everyone to be part of the solutions to create equitable and really sustainable in a way that has longevity, not just sustainable in a way that's healthy for our planet, but in a way that can keep going for generations. And it's important that all of our voices are included.
And we are back. So thank you so much, Daphne. It was super powerful, super inspiring, and I love that it ended in a call to action for all of you. And I think after talking to all of these CV friends, the thing that stayed the most with me is how relevant it is to keep on working on creating more data that includes the most vulnerable, more data that includes all genders, all ages, do better research to better understand the impacts of health done by climate change.
Absolutely. And I think if there's something that we learn as well from Daphne's intervention is that we often neglect a part of the population, that's those that aren't even in this planet yet, right? So ultimately the choices and the actions that we make today will not just impact the health and well-being of our planet, but our own and the one of future generations.
And how to assess this, capacity building. Capacity building is key here because we need the skills and we need to bridge those gaps to work and address the health impacts on climate change.
Absolutely, but capacity building at all levels, right? Capacity building for ourselves, for those that are watching this video, for healthcare professionals, at the policy level, to make sure that health considerations are integrated and embedded into policy, climate policy specifically, at the community level as well, right? Building up climate resilient ecosystems and infrastructures that can help us essentially continue to thrive, nourish ourselves, and our communities, and live in this planet.
Yeah, and well-being. Know everything about well-being to stop being that anxious about climate. So I think this was a very interesting episode, and I hope you also think that.
Indeed, and we'll see you on the next one.
Bye,
Bye,
besties.
besties.